We selected QSI because what we liked was it integrated really well with the NextGen product set, and that meant a lot to us. So the ability to move demographics around and move patient information and billing information seamlessly for us was really important. The other products we looked at did not have that integration level that we needed to make this work well for our products and for our clients. For us, prior to using the dental product, it was all paper charts for the dental side. And so that meant charges were typically done on a separate fee ticket and was passed to the billing office, and then they had to calculate it and send out the bills. There was not good care coordination between primary care and the dental side. And then subsequently patients would present, and the dentist may or may not get the full history of what meds that patient's on and other issues they may have going, medical concerns that they had going. So it was all paper chart prior to this. In demographics, the patient would have to then fill out a form at the dental office, restate all their age, address, things of that nature. So it didn't flow easily between the practice management side of the house and into the hands of the dentist and the dental side. The first thing we noticed was that the implementation went really well. So QSI partnered with us really directly with their project management team, and the implementation, the whole startup was very fast, and we brought up 4 community health centers in a year, and that's a lot of patients. And what we saw also was now our dental side and our medical side are getting well integrated. So what that means for our patients is their primary care provider can take a look into their dental record and see what treatment plans being proposed, and also importantly for our dental providers, when the patient shows up in the dental clinic, then the dentist can take a look and see what meds are on, what the treatment plans are going on the medical side. And frequently what we see happening is the primary care docs and our dentists communicate about a patient for coordinated care, so they get a good care plan for their what they need to have done. And also what happens is we get good visibility when a patient shows up to their meds list. So allergies, medication history, all that becomes available immediately to both the primary care and the dentist, even though the patient presents in different locations. What I would say is make sure that your dental product interfaces with the rest of your systems, really particularly, again, interface with your billing and with your practice management system if you have one. That was the big win that we got for our dental staff. It was a win from day one, and it really helped with satisfaction. It makes a lot of sense, especially when you get good integration between your billing system and your practice management system to start moving that information back and forth. Again, move demographic information into the hands of the dental staff and to bring back billing and charges back into your billing system seamlessly. It's made a huge difference in staff time and satisfaction. Our dentists use the practice management system for scheduling, and that has been very helpful for the clinics and practices because they have one common scheduling system for both medical and dental. And as community health centers provide integrated care under frequently one roof for both dental and medical, having that common scheduling really helps the front desk and the scheduling people coordinate how they work with patients, and it's been a really big improvement for them. So the patient does get better care because they get to develop coordinate care plans among our patients. So we typically have a lot of chronic condition patients for community health centers, and getting that continuum of care so we can coordinate is really important. So the fact that the dentist can look up the meds list, that the dentist can look and see what chronic conditions the patient has, keeps them aware of what they may need to look for when they treat them on the dental side. And then when the patient presents again at the medical side, they can see what took place on the dental side. They know what work was done, what care plan was in place, and then they can coordinate that. At the end of the day, it really does improve care for our patients because now it's a coordinated, integrated effort.